Hey everyone, I am April Young and I am going to talk to you about gout. Gout is an inflammatory disease that occurs when urate crystals accumulate in the joint and cause inflammation. The body naturally produces uric acid when it breaks down purines, which are found in the body and also found in certain foods and in alcohol. And when the uric acid level rises in the blood, it can cause urate crystals to form. So gout usually occurs in the large joint of the big toe, but it can also occur in the feet, and the ankles, in the hands, and in the wrist. And when this happens, acute gout attack is characterized by a severe, abrupt onset of extreme pain. These patients experience inflammation, redness to the joint, swelling, very, very tender, and sometimes it's so bad it even wakes them up in the middle of the night. So what increases the risk of developing gout? Consuming foods that are high in purines, such as meats, organ meats, and seafood. Also ingesting large amounts of alcohol, especially beer, has been found to have high levels of purines in it. Obesity increased your risk. Certain comorbidities such as uncontrolled hypertension, diabetes, chronic kidney and heart disease, and metabolic syndrome increase your risk. A family history or a past medical history of the patient personally, they're more likely to have a recurrent attack of gout. And their sex. Men are more likely to have gout than women, especially in their 30s to 50s, but then after menopause, women are just as likely to develop gout as men. So when you're seeing these patients in the office, you need to ask them about recent dietary changes. Are they consuming foods high in purines that they weren't once consuming? You need to ask them about their alcohol intake. Has it increased? Has it changed? Are they drinking more beer? Then you also need to ask them about their past medical history. Do they have any of these comorbidities that increase their risk? Do they have a personal past history of gout before? Once you've done this and you move on to your physical exam, you really want to focus on your vital signs. An elevated temperature is a sign that's associated with gout, and you want to monitor their blood pressure. Is your patient hypertensive? Especially if it's uncontrolled, they're at a higher risk of developing gout. Then you want to inspect and palpate the affected joint. Look for inflammation, look for swelling, look for redness, look for deformities, see if they're tender to palpation, those kind of signs that would help you to come to your diagnosis of gout. You also want to look for tophi, which are characteristic of gout. They are urate crystal deposits that turn into these little nodules in the joint, and during an acute attack, they can become inflamed and tender, and that is specific to gout. After you come up with your diagnosis, the CDC and the National Institute of Arthritis have recommendations for treatment and for teaching the patient. They recommend treating and preventing future attacks with NSAIDs, such as over-the-counter Advil, or using prescription strength NSAIDs, such as indomethacin, which is what I personally always seen used in the clinic setting. You can also use, and I might butcher this, colchicines, which is a specific pain reliever used to treat gout. You can also consider using corticosteroids, which would help reduce the inflammation and the pain of gout. There are meds for chronic complications from gout if the patient has developed chronic gouty arthritis that reduce the body's production of uric acid, and these drugs are the xanthine oxidase inhibitors, or the drugs that increase the excretion of uric acid from the body, such as probenecid. They also recommend teaching these patients to limit their consumption of foods high in purines, to limit or completely avoid alcohol, especially beer, altogether, and to maintain a healthy weight, since obesity is a risk factor. But you do want to teach these patients to avoid starvation or rapid weight loss, because that can actually temporarily raise the uric acid level in the blood.